My name is Jason Hines. I'm CEO and co-founder of Gigasheet, and I'm joined by Dhruval Patel from SumHealth today. Dhruval leads product development strategy there. He's also a physician, an internal medicine doctor in his residency at University of Chicago. Is that right, Dhruval? Did I get all that right?
Yeah, resident in internal medicine and pediatrics. Yeah. All right.
So he's actually very more overqualified, I would say, but maybe not. He's got tremendous knowledge about the space, obviously as a provider, but also on the analytics side, and we've had a ton of fun working together. So we're going to dive into it now. Basically, the aims of this session are we're going to talk about where pricing transparency kind of started and where it is today. We're talking about some new directions with the tick data and machine readable files. We'll talk about some of the issues and how we're working together to solve those. Um, we're also going to discuss some examples. We'll show a live example. And then we'll talk a bit about stakeholders and how they can take advantage of this data. So with that, I'll give you a quick introduction to what we're doing at Gigasheet. We very much come at this from a technical angle and perspective. We have a big data analytics platform that makes it easier to work with enormous data sets. And it turns out that it's very good at working with JSON, which are what MRFs are composed of, JSON files. It also is very good at working with enormous CSVs. We had this idea that just because the data is incredibly large, doesn't mean that it should be hard to work with. And so we present it in a spreadsheet-like user interface. That's the whole idea behind our company. It turns out that this data has a lot of problems. It's a huge mess. If you've ever tried to work with it, you probably were left scratching your head. And both of our companies actually are really working to simplify it. We're coming at it from kind of different perspectives, but I think that is absolutely something we have in common. Um, some of the things that we work with on the data side are these files are enormous, especially the payer files. You may be able to open some of the hospital CSVs on your desktop or laptop in something like Microsoft Excel, but many of them are over a million rows. Many of them are now in JSON format, and that can be difficult to work with. Uh, Particularly with payer files, we see zombie rates. As much as 40% of the data in those files can be irrelevant, where you see billing codes paired with providers who would never actually bill that in reality, and it just turns out to be noise. Um, Results can be hard to interpret. This is something Druval is really amazing at. He brings so much perspective to that, but I've learned a lot about it as well. Um, it's hard to really understand what's going on. This billing is very complicated, so we have spent a lot of time working on that. And fields are often inconsistent and require multiple takes. It's not as simple as plug and play like it probably should be, and hopefully will be one day. Um, that's really why we built our product. It allows providers, payers, and even device manufacturers in medtech to take advantage of this data and actually see what's in these files and look at the information that's in there. You can use it for a whole variety of different use cases, from network development to market access, recruiting, or even negotiating contracts. Um, that's a little bit about what we're doing. We've been seeing this data for several years now. Since the rule came out, people have been loading that data into Gigasheet, and until really the last 18 months or so, much of the data was not very usable, I would say, in my opinion. Um, the it in the last year and a half, it has become much more standardized, and that is helping. It's still far from perfect, but things are progressing and it's becoming more valuable. How our system works, we source and extract machine readable files, both hospital and payer files. We run it through a pipeline of cleansing and enrichment and review that and inspect it, work with our clients to make sure they're getting the quality and fidelity that they expect from that. So we do some verification and validation, and then we deliver it in our platform, which you'll see a little later today. When it comes out, it looks something like this, sort of like a giant spreadsheet where you can slice and dice it however you like. That's pretty much a very quick overview of Gigasheet and how we are playing in this space. I'm going to turn it over now to Druval, and he's going to talk about SumHealth and some of the very cool purpose-built UIs they've built on top of this data for specific use cases that really help you get like right to answers quickly.
Yeah, thanks so much, Jason. Appreciate that introduction. In terms of what we're doing at SumHealth, we are really foundationally started off as a team of those who have a medical background and a technical background to see how we can help modernize the healthcare system, particularly from a data perspective, because I deal with data every day as a physician, immense amount of data per patient, but the language of data is how we standardize and communicate between the different systems to help every single one of us. And with those two backgrounds from the data science and medical context, we begin our approach in building products from how can we let anyone, any stakeholder in their healthcare system interact with this data a lot more easier and then develop insights that they can actually implement in a real world realistic setting. Our focus on pricing transparency was that this is a problem that I think benefits extremely well from this approach because as Jason mentioned that the level and size of data that's there is immense. What Gigasheet is able to do is now provide the ability for anyone to interact with that data and our approach, which we feel synergizes extremely well with Gigasheets, it's now provide you with a layer to interact with it so that you can take it into your own context. And our bespoke approach allows us to build applications for anyone, any one of our clients to do just that. Next slide, please. Thank you. What our approach is we created our own healthcare pricing database initially so that we can create these application layers on top. We start with the hospital data and the payer data, and we'll go into kind of the ontology of that from the background of the CMS mandates in just a little bit. But that helps us create a pricing transparency database, and from there we've created four separate applications that we feel have been sort of the four major domains of where pricing transparency can start with. And next slide, Jason. These applications we have presented here, we refer to these as a SumHealth stack internally, but essentially the three major ones we have are our flagship platform, which is Benchmarks. It's essentially an intelligence tool that instantly allows you to take the rates that have been cleansed or uploaded via, for example, like our partner Gigasheet. We can then instantly analyze it in the front end and give you insights based on your own context. The form you see here on the left is for those who are in the revenue cycle space. Some of our clients really love to know what the commercial payer rates are and how those benchmark against their own utilization protocols to help with revenue cycle negotiations. And our instant analysis does that very quickly, all in one app. Clear cost is something that we wanted to keep available to the public, where if there are any individuals interested in figuring out what their out-of-pocket cost is, every single hospital has their own calculator, but we have been able to create a universal calculator for every hospital across the United States, building on top of the hospital data. And finally, True Charge is an application that allows anyone to upload any CMS 1500 or UB04 bill in any PDF format. It instantly recognizes the codes and the pricing and then benchmarks it against the national mean or medians based on these codes. But these three applications, it's expressing our ethos here that we want to create an experience on pricing transparency and not just have individuals use the data and try to derive insights from themselves. That I think helps us lower that activation energy of interaction with it. These next set of slides were something Jason and I felt we wanted to share, which is to give everyone sort of a grounding basis on where pricing transparency is and how both of our organizations are working together to help bridge the gaps. In particular, just for everyone to be aware, pricing transparency data comes from two main sources, and these came from two main mandates. It was the hospital pricing transparency laws and the transparency and coverage laws, both of which got ratified around the same time and are enforced by the Center for Medicare and Medicaid Services. And both of these data sets, they're updated on their own time. The hospital data only is updated every 6 to 12 months, where the transparency and coverage or payer data is updated monthly. This is actually the updates, the automation of these updates is actually something that, as Jason mentioned, Gigasheet is able to provide. And then from there, what we want to present at the bottom here is the form factor of both of these datas, either in a JSON or a CSV format. They seem pretty to look at, but it's still incredibly difficult to derive any insight from it for a user such as me, who's a physician, or even one of my patients. Although if we go line by line on the CMS laws, all of those suggest or state that they want patients to take advantage of it, and this absolutely is no form factor for a patient to take advantage of.
I think you have a twisted reality of what is beautiful. Maybe you should, if you think this data is beautiful,
It
you're
looks
being
well
very,
organized, but
very
definitely tough
kind.
to
You're
use.
being very kind.
Um, in that context, what we have internally been discussing, Jason and I, is how to describe the fact that despite this data being open and present, there's still many silos in which they exist, and the business models and entities that have come up to help lower that activation energy still work in, I would presume, in their own silos. In that sense, the first silo really is this process of data gets ingested, and then a vendor has their own specific ontology on how they process and parse this data. And then the second silo is this data is packaged and sold. But oftentimes, users might be thinking that they are buying just, that they only have access to an entire state or they have access to an entire country's worth of data. That could be useful, but there could be a lot of bloat in there that could not be possible for a user. But in the current form factor, for a lot of these data offerings, it's very tough to distill down to what I actually need before I can actually derive insights from it. Eventually, this data gets packaged into a proprietary platform, one of which is SumHealth's offering for sure. But in both of these scenarios, there is still a lack of transparency before the data gets used. And what we feel Gigasheets and SumHealth does together with our partnership here is democratize that process.
That's right. Like I think one of the strengths we have is the ability to drill down to like every row, every cell level detail to trace. When you do see things that don't seem right, you can trace it back to that and see what was actually in that original file. Sometimes that's just the data that's published. Sometimes there may be a facet to it that you need to account for. Um, I should also mention, not to interrupt, that we will be taking questions. I saw some come through. We'll address questions at the end. Feel free to put those in the chat panel in the Q&A, and we'll come to them.
What we wanted to present this slide with is just contextualize really the three major domains that still exist in the pricing transparency space. Now that data is accessible, the amount of data is massive, particularly the ones from the payer data side. They can be hundreds of gigabytes of storage and require many gigabytes of RAM to even open up and parse through. And this creates a lot of bloat. The bloat can be in the setting of payers having duplicate files, ghost rates, many issues that come up even after this data is downloadable. And the other issue is that these files are solely machine readable, meaning you need a machine at least capable enough to open these to help you parse through it. Something that Gigasheet has actually basically eliminated the need for, because now you can open up these files on a web platform and not need any more compute resource than what you have on your personal computer. And then limited interoperability, I apologize. Essentially, a lot of these data ingestion processes, ontology processes, they have very black box approaches because everyone kind of has their own proprietary way of doing this. Our platform at SumHealth, our intelligence side of it in particular, actually now we work hand in hand with each one of our clients to develop the features that they require for their own use cases. So it's not as if they're buying just one standard set or one standard methodology. We can actually have this data be applied to their own personal context. And what we wanted to present is sort of our end vision of what does this democratization of pricing transparency look like? Because that's really the end goal with our partnership here. The first is that we want to begin by solving this problem of access. As I mentioned, because this data is so bloated and the way its form factor already looks like a whole bunch of rows that is just tough to interact with, we want to be able to create an experience where individuals can understand exactly what's in these things before they use them. We want to then provide an instant amount of context to them, which is what our intelligent platform ends up doing. We also want to provide the ability to help you understand what exactly it is you need versus having to purchase a giant data set and try to explore it on your own terms, because this data does exist, but that extra level of customization is very difficult to find. And yet our partnership is something I feel achieves that. And then finally, at the end game, we want to make it interoperable, meaning that we want to be able to produce you use exactly the data you want in the context you want, because this data is so applicable in many different regions, but applications that customize and curate that are very, very minimal, yet our partnership can achieve that for you guys. And so what does our partnership really do in terms of bridging these gaps, particularly from the Gigashi side? And it's something that I was very impressed with when I first started using the application, is opening up a payer data file or a hospital pricing transparency file can be very static. In Gigasheet, once I open it up on my web platform, I'm able to be very modular with the data, organize it, figure out what I need, what I do not need. And for those who are more versed in the pricing transparency space, you start to understand just how valuable this becomes. I'm also able to parse through and read the data a lot more clearly. And then finally, I'm able to be very flexible with the output that I can get from this. What that means is like if I need it in a specific format, if I need it in a specific way that interacts with other applications, Gigasheet can do those automatic conversions for me so that I can actually put it into the context that I would like for it to do. And then with SumHealth, what we are bringing in is that extra level and customization of that context. But what we're really able to do is take all of this data and allow individuals in teams, in firms to start parsing through this data in natural language, to talk to it, to understand it in a way that makes sense for their own workflows. Where then also we have instant business intelligence tools and applications embedded in. So you're able to get instant analytics, things that you don't have to personally do for yourself. And then finally, we're able to scale down this data and the insights from it from a single practice and scale it all the way up to a nationwide average for every single unit or piece of data that's in there, but all of which happen in one application and none of which require you to be an expert in data science at all. So literally our partnership kind of combines together to one, lower that activation energy to even interact with the data, two, really understand what you are getting and how you're getting it, and then three, be able to put it into your own context and have your team use it for your own purposes, all without introducing any new friction to your environment. This is a visualization really of what we feel this end partnership does look like for anyone interested in taking advantage. We're essentially parsing out payer and hospital data that looks like this, instantly can get uploaded into Gigasheets and be able to customize and process this data, and then be able to generate intelligence insights from the SumHealth side by way of at least our benchmarking tool here, which helps you compare and contrast all the rates almost instantaneously. And this process is extremely recyclable, is very repeatable, and extremely accessible. And honestly, it does not take it does not take any resources to set up besides just the applications that you see here. Jason, did you have anything to add?
No, I think we should dive into it and take a look at
Got
this.
it.
I'll show you a quick demonstration of some data in Gigasheet that we'll look at, and then I'll turn it over and we'll look at some health. So this is the Gigasheet web-based user interface. What we're looking at here is Blue Cross Blue Shield data for North Carolina. This has been compiled from perhaps multiple different files and plans, but in this output, there are just about 85 million rows of data we can see here. And you can see all the raw data that's included, everything from the name and billing code to the code type, the negotiated rate. We incorporated Medicare rates and percentages as well. Any modifiers, place of service, there might be a different rate if the service is provided in a hospital setting versus a surgery center or a doctor's office. Um, and you can see all of those details here. We've also enriched it with NPI data, so you can see the primary taxonomy of the provider, as well as all the details, where they're located, their name, address, and then we always keep track of which entity was reporting it, the file name, when it was last updated, and so forth. So if ever there was a question, this really speaks to what Druval was talking about, black box. Like you can always trace this back to where it came from and exactly what was in it. And it's easy to sort of filter this, group it. Like if we wanted to drill down to just a single hospital, for example, we'll do that. So now we're looking at just 884 rows of the 85 million or so. And you can see in this data set that we've got a bunch of MS DRG codes for this Brunswick hospital. And we can do things like quickly group those to see, okay, in this particular reporting payer data set, we've got DRG codes and
Hmm.
HCPCS codes as well. And you can start to group these, like maybe I'm only interested in J codes or Q codes. Maybe I'm looking at something for market access. So you can drill all the way into a single hospital or even look at a group of hospitals. In this case, we're going to look at the Novant system here, and you can see I've got all the different various locations.
Yeah.
Uh, what these are just bookmarks. So you can build up these queries where you can add rules. Like maybe I'm interested in a set of zip codes, or I'm just interested in Charlotte, North Carolina, for example. And you can come in here and add those as well. Like I said, maybe I'm just interested in Q codes. So I could filter down to that. I could easily compare across these hospitals. And then when I'm ready, I can export the data as a CSV. So this is only 17,000 rows of data now. Easy to work with in pretty much any application, um, down from the 84, 85 million, where it's really just not possible. That is a whirlwind tour of Gigasheet. There are lots of other feature functions to slice and dice this data, drill down to, the individual rate level, add
Mhm.
additional groupings, and see exactly what's in these files. Um, that's,
I
yeah,
just wanted
go
to
ahead.
share, Jason, like as someone who intimately is familiar with these files, this payer data file is almost always impossible to open up on anyone's local computer. If, for example, a physician or even a patient wants to understand what's in these files, they could do that instantly on Gigasheet and have instant ability to filter, relate, and narrow down and do technical data science level processes almost immediately. Pricing transparency data, in order for it to be effective, demands that kind of service to exist. And this presentation here, what Gigasheet allows individuals to do is honestly one of the first most important steps, right? And when I was starting to use it to understand where we are at, it was almost like, wow, this is like something that makes anyone's life working in this space or using this data so much easier.
Very cool. Now
Yeah.
let's take a look at some health. You guys are doing
Yeah.
some pretty cool stuff as well.
Yeah, and then for example, let's say you're processing the data on Gigasheet, and then you want to be able to use that data in a way that helps you curate sorry, I'm just going to upload. So it helps you curate more intelligent experiences. Then what we have here is at least one of our platforms, our flagship platform, Benchmarks. What Benchmarks is designed to do, it relies either on the payer data database that we have or the hospital data, but you can also upload your own customizable data, and we can start searching through the codes. For this instance, I just have CPT codes pulled up, but we can go through any class of codes. I'll just pull up a prime search that I had before, one of these codes here, and then we'll select through a course of hospitals. Let's say, I think Jason mentioned North Carolina, so I'll just go around North Carolina. I'll range it out to about 100 miles, and we start to see hospitals that are popping up within that almost instantaneously. We'll start to just start selecting hospitals and seeing what their negotiated or standard chart rates are, and start to see if there's anything that we can benchmark. It looks like just within the Novan system, pretty consistent, same reimbursement price. Let's try to bridge out to Ascension Macomb. They seem to have a bit of a different negotiated rate. Forsyth, it's the same thing here. Rutherford, we have a different set of rates. Three Rivers, and the more and more we blow it out, the more and more we see that there might be some hospitals that might not even have a negotiated rate for that code. They might be using a different billing practice. Some hospitals might have a far larger degree of variation, and we start to see how those different variations exist. For our users in particular, they are able to then instantly take this data and apply it to their own revenue cycle negotiations based on their practice. But the use cases are many, because what we're able to do is allow pricing transparency to now be instantly used as an inference or a surrogate for other findings, so that individuals who are in at least the analyst space can take advantage of it, for example. But more specifically, we customize and create our applications for workflows. So as this data that we process on Gigasheet and you know exactly what you're getting, we can then create an out front end for you that helps you understand and analyze it for your own workflows almost instantaneously. But that's kind of the work that we do here at SumHealth within that pricing transparency space.
Very cool. It's always nice to have like graphs and charts. It's so easy, pictures,
Yeah.
speak a thousand words. And I think, you can see like rolling up from billions of rates down to like a simple bar chart is incredibly valuable. That's really what we had planned to share with everyone today. Thanks for joining. We'd love to answer a few questions. I saw a couple come in on the chat panel. But Druval, how can people get in touch with you guys at Some Health if they're interested in
Yeah.
learning more?
Absolutely. We come through a couple of ways. First is obviously somehealth.org, our website. There's a contact us page there. You can also email us at contact@somehealth.org. And then finally, we're very active on LinkedIn, sharing our insights and our products, and definitely direct messaging us through there is absolutely something we respond to.
Cool.
Yeah.
Nice. And for anyone interested in Gigasheet, or if you'd like to look at some sample data, you can contact us at sales@gigasheet.com, or you can visit our website and book a time directly with someone on our team, and we can work with you, answer any questions that you might have. So one question, the first question we got is an easy one. Uh, I'll let you answer it, Drew. Will this session be recorded?
Yes, absolutely.
Yeah, we're going to share a recording with everybody, and I think we're planning to post it publicly. So yes, you will have access to that after after the session. Um, yeah, so can I got a question here. Can we parse the data into natural language so you can begin to talk to it? Uh, we actually can do this in Gigasheet, but I don't know what I we haven't talked about this before with some health.
Yeah.
It's super interesting. What are you guys doing? If
Yeah,
yeah,
no, essentially the TrueCharge application we have, it's the domain is actually truecharge.ai. We have our own fine-tuned model that we actually use to help talk to our pricing transparency database. And what we are able to do is actually uh, get use that platform in order for you to directly talk to the database that you would like to. So that's really the next step that we feel pricing transparency is going to go to, is individuals just really want to not need to even for those who are less technical but want to just understand prices. That's really the next phase, and we have the tools to do that. Just need to build the front end. If anyone's interested, we'll love to talk about it.
yep. So that's very cool. In Gigasheet, you may have seen on the right, there is a panel called Sheet Assistant. And the Sheet Assistant actually just ran it. And here, the Sheet Assistant is like kind of like an AI copilot that helps you um, navigate data. And you can ask questions in natural language. So I just asked this question, which NPI has the highest cost for I copy and pasted this value for arthroscopy shoulder. And one of the things we think is really important about AI is that it be very transparent and explainable. So you can see here, it responded, I will find the NPI with the highest. So it kind of restated what it believed I asked, but then it shows every step that it took. So it applied filters on the following column. It filtered on the name, which looks like it's right, and I can easily check that and inspect it because as we all know, these things like aren't perfect. So you want to be able to like verify the results. Then it grouped on the column for NPI, which seems like okay, it did that, and then it sorted by the negotiated rate. So now we can see, yeah, it did a pretty good job, and then it summarizes the results. Let's see if it got that right. 77, 77 here. So both MPIs have this both of these are the same, and it was right. So you can ask questions like that. It's by no means perfect. Like, I mean, if you've played with AI, you probably know that. Like, I could say, I don't know. Instead, now let's see if it could do the same thing. I'll ask it for instead of shoulder. I don't know. I'm feeling.
That's
Uh,
another common one.
yeah. Uh, I don't know what it's called, so I don't know if it's gonna. It did it by name, so we'll see. Feeling it may take a second, so all right. Yeah, that's kind of what I thought. So basically, that's because I don't know off the top of my head what it's called, but we could easily fix the query and then jump into, I have to look at, oh, billing code. Yeah, it would be the name contains, like me, for example. We'll just do that. So a lot of times what we find is even if it stumbles like that, it helps you kind of get there, right? Like it's gets you started down the path. So you may have to like go in and correct it, but yeah, it's making progress. We continue to invest in that. I wouldn't say like, oh, I'm ready to, wouldn't bet my life on it or anything right now, but it is helpful, especially if you're unfamiliar with our user interface. There are a lot of buttons to click. It can help you get started, and we absolutely see people doing that. Let's get to some of these other questions. Uh, yeah, there another question about the recording. I think that's true. Uh, Have you aggregated each state's Medicaid data? That's a great question. Um, I can try. I'll say what we've done.
Hmm.
The answer is no. We haven't aggregated each state's Medicaid data. However, we have added it and integrated it with payer and hospital data on occasion when our clients need it. Medicaid data isn't always, I think it's, correct me if I'm wrong, Druval, but I believe it's state by state. They
Correct.
have different policies. So some states it's very easy to access. Other states it's accessible only to approved, really insurers in the state and people in the payer ecosystem can access it. And it's sort of limited. And then in other states it's like virtually inaccessible, like there's no, it's totally opaque. So it really, that my experience has been it varies widely. On occasion, we have been able to retrieve it. And I mean, if it's out there, you can put it in Gigasheet. It's not a problem. But I don't know. Have you guys thought about this or been asked about this, Drew?
No, we have as well because in order to get a good understanding of like the wide area of how money's moving in the healthcare system, the commercial and non-commercial data needs to be melded together. With Medicaid data in particular, the claims data is something, as Jason mentioned, is very difficult to acquire in many different states just because of their policies. There are I think a group of about 10 states that have ratified their own laws to make their own Medicaid claims data publicly available, although the actual launch of that data is still yet to come, but we're looking very forward to that because that'll give us another layer of granularity. Yet, though, what both of us do is we think it's very important. The industry does this often is benchmark against the CMS fee schedule. That's something that's available readily within Gigasheet and within SumHealth as well. But more importantly, I think what Jason mentioned, where if you want to upload it into Gigasheet, process it, and then give it over here to benchmarks to help you develop analytics from it. That's is essentially what we are here to do for you guys. And Medicaid claims data is a great place to start with that.
Yeah. The
Yeah.
claims data, uh, and the fee schedules, they're both super interesting. But yeah, usually you have to pay for the claims data, as
Yeah.
has been our experience. If you do have that data licensed, we can layer it in. Probably both products can, but it's uh, it's still opaque, I would say. Um, or limited. In some health, in the imaging example that was
Mhm.
shared, how do you ensure you are comparing like the technical versus the
Mhm.
professional versus the global rates correctly? It looked like you were getting rates for all three. So for those who aren't familiar with this specific, the specifics of imaging, there are usually three components to this. Sometimes there's one component where it's all rolled in, but there's a billing modifier TC for technical component. And then I think there's another modifier. It's a number I forget off the top of my head for the professional component. Um, and then they'll have a rate rolled in together. This is because sometimes you get the X-ray taken or the MRI, and it gets sent to another place where the radiologist reads the image. So they may bill for the professional component. The place with the machine bills for the technical component. And then sometimes it's all in one place. Like if you go to maybe an imaging center, they might have radiologists right there. So they would get both. And this is a good question because I think in a lot of systems, it is on, you want to be able to kind of piece that out and account for that in the results. And in a lot of black box systems, you can't do that. You just kind of get what you get. So
Yeah.
anyway, sorry, I rambled. I explained
No,
way too much of the
that's honestly
question.
perfect. But I actually honestly really appreciate this question because it goes into what I was mentioning regarding the black box. And to answer the question more clearly, the three prices that we presented here, those three were just in instant calculations of the averages of the prices themselves, the range, and then a benchmark against a nationwide median. The actual price that you're seeing here is solely a standard charge, and we just presented the global rates only because that was something that can be easily pulled out immediately from the hospital database. But technical and professional are absolutely available in the hospital, but more actually density in higher density in the pair database because both of these schemas and formats do have a section for the modifiers. And so in another instance, if we have a client who's very interested in looking at these specific pieces of granularity, then we introduce that modifier functionality as a filter and are able to present that to you too. What we want to be very honest with is that we are presenting the data that is out there right now. We are analyzing the data that is out there right now. There are often probably some gaps and many use cases and instances that might not exist just yet. But even the mandates that have been kind of proposed under the new executive order earlier this year are hoping to develop new schemas that continue to do that. But with Gigasheet and SumHealth, we have I would presume to be very early in this space, and we're very, very fine-tuned, putting our ear to the ground to those in the future. And as the quality of the data, the sensitivity of the data increases, so does the value of our tools as well. But as I mentioned, our pipeline here allows you to see exactly what you are getting and then give you exactly the context that you need.
Cool. And that's a great segue into this question. Is any of this aggregated data you're mentioning available for free of cost outside the useful and attractive UI platform? So, um, frankly speaking, I think what most of the cost for both of us probably is actually the compute resources that are needed to process and store this data. To be clear, all of this data that we're talking about is absolutely 100% free. Anyone who tells you otherwise, you should be very skeptical of. This is all free data. It's all freely available. I will say it is not easy to access as maybe we would hope. In some cases, there are limitations or APIs that restrict how much data you can download, how quickly. But overall, I would say most payers and hospitals are complying. Um, there are still some who are not. There are some who are in compliance partially. There's a spectrum for sure, but the data is freely available. It is incredibly large. These files can be many, many gigabytes to terabytes in size. They
Mhm.
often come in very relatively small, like you may have to combine 4,000 2 GB files or something to get to a single file, and then half the data in that file is not relevant. So you've got to pare it back down. So um, that is a very resource intensive process to distill that data down. Uh, so short answer is data is all free. The aggregated data, it it depends. I guess probably not. That
Yeah.
generally speaking is not freely available. There are websites where you can look up things for free.
Mhm.
I don't think my experience hasn't been they're very reliable or high quality. I don't know. You want to add anything to
Well,
that? But
actually, just to add to that, when I was first learning about this space a little bit more, so we can get involved with the data, I did read through the laws, the updated Medicare laws like CY 2019, 2020, 2021. And in it, in any amendment to the pricing transparency laws or to the original law, the lawmakers have all intended for industry to fill in these gaps. They mandated this data to be available, but they do want industry or those who are experts to help provide context and fill in these gaps, such as this process of aggregation or this process of interaction. What we're trying to do here is do that, but do it extremely accessibly and do it extremely cost affordably relative to a lot of other offerings that are out there. And that's really what we feel is something that is missing in this space, but it's something that we want to offer.
cool. Another question is on pricing. How do we price or sell, or how much does it
Yeah.
cost? We got a couple people asking that. Um, I'll go first. Gigasheet, it really comes down to how much data you want to process. So typically we will do this by defining a number of payers and then the market, everything from nationwide to a single state or region. And those are typically the two dimensions, but we have kind of, as you saw in our product, like total flexibility. So if you're just interested in like nationwide for a certain uh, clinical area, we've done stuff like that. So it really depends. And happy to discuss that uh, as a follow-up if interested. Um, Drupal, do you want to? Let's talk
Yeah.
about some health.
We also, as we are initially working to have our own pricing transparency database, the access to our application and the pricing of that is dependent upon how much data needs to be aggregated and used to be analyzed. There is a flat charge just for the application itself. And then what we do is two major kind of paradigms. One is how many instances you require for your team, and the second is what other customizations do you need from the baseline that we can help develop, and we often price that accordingly based on how much data is required. But I feel like our partnership, when in regards to just the data cost itself and the access itself, I think that's something that really brings that piece down. And what we can do and offer is more importantly create that application experience.
Cool. This will be the last question we take. Do you have an API? That we do at Gigasheet. We absolutely have an API. So you can push data to Gigasheet, have it process it, and then pull it out. You could filter it using the API and just pull out subsets. Pretty much everything you saw me do quickly in the user interface can be done via our API as well. So yes, we definitely have an API, Drupal.
Yeah. To each one of our applications in our stack, we do have an API, so you can bring up that entire application within your instance and just call back and forth, irrespective of what kind of processing you require and insights that you need. But each one of them can be brought up just immediately, instantly, calling through one central sort of API that we have.
Yeah, very cool.
Yeah.
Makes a lot of sense. We are at just 45 minutes past the hour. So thank you everyone who joined and thank you for the questions. It's always nice. And yeah, we hope you got a lot out of this and hope you have a good day. Thanks for joining. See ya.
Thank you.